Hello, I'm Dr. Robin Stones and I'm a dermatologist and I'm working from Courthouse Clinics in Wimpole Street in London, and today we're going to be talking about intense pulse light or IPL treatments. IPL is a term that means intense pulsed light. Technically it's not a laser, to be honest, because a laser is a light source that emits one single colour of light, whereas an intense pulse light machine, although it's often referred to as a laser, is a broadband of white light, all the colours of the rainbow in there. And we use a series of filters to block out the bits that we don't want. So it is a light source, and when we shine it on the skin it will target certain things, usually blood, so thread veins for example, or pigment, melanin, such as freckles. It's not new. In fact, technology has moved on considerably in the last few years, because IPL appeared in the early 90s and it has been gradually developed and refined since then, so it's a well-established treatment worldwide for this type of skin problem. If somebody has multiple freckles, or they have thread veins over a large area of the cheeks, then with the intense pulse light we can cover a large area quite quickly, treating all of those things at the same time. Well, anybody who's got thread veins on the face will be a suitable candidate. Some freckles that are there all the time, they will respond as well. Or minor textural changes of the skin will improve with IPL treatments. Those will be the major indications. Well, gradually with time it's a progressive condition, so we would see more freckling occurring, and the freckles that were present would probably become a little darker. We would see more in the way of fine lines and wrinkles, and probably more of the vascular or blood vessel markings as well. So the whole picture would just become worse. When we apply light to the skin of various types, we know that there are more effects besides just the very specific targets of blood and pigment. We know that it actually stimulates the fibroblast cells in the skin, and these are the cells that are the natural repair mechanism within the skin. They manufacture new collagen and the elastic material that helps to keep our skin supple. So a course of IPL treatments can have additional benefits in the sense that overall texture and tone of the skin can improve, albeit modest. It's not a dramatic change, but very often people will comment that the skin looks fresher and brighter after a course of treatment. We need to be careful on skin type with IPL treatments. The reason for that is that it does target pigment colour, brown pigment, melanin pigment, very strongly. So we can only really use it on lighter skin types. If a patient has a dark skin, for example a dark Asian skin or Afro-Caribbean, African skin, then all the pigment in that skin will attract the light, and therefore there's a significant risk of burning. So we're going to be choosing IPL treatments in sort of Western white Caucasian people, olive skin, Mediterraneans, and perhaps light Asian skins, but not darker than that. Potentially there are side effects, so you need somebody experienced to use the machine. And the key to a safe practice is actually understanding what you are doing, the way the light interacts with the skin, and knowing your own machine and the settings to use. And that's one reason we do test patches before a treatment, is to find out how an individual's skin reacts to our machine and our treatment, and then we can choose the most appropriate and safe settings for the treatment. After an IPL treatment, the patient needs to be particularly careful not to expose their skin to sun. There is a risk of pigment disturbance if they do that, so we advise the use of regular sunscreen. But because there's no open wound on the skin, as the light doesn't actually break the skin in any way, it's absorbed from an external source, cleansing and skincare can continue as per normal. In most cases we can see long-lasting results from an IPL course of treatments. However, it is vital that the patient really protects the skin. The sun is the one factor that's going to make the treating things recur. So sunscreen is absolutely essential. If we're treating a condition such as rosacea, which is a progressive condition, then yes, we will get a good result, but more veins and redness may develop over time. And in that case, we just offer a further course of treatment. Most IPL treatments will be a series of treatments. We see a gradual improvement after each treatment. For freckles, we may be doing 3 or 4 treatments. For thread veins on the face, we may be doing up to 5 treatments. It's quite variable on an individual basis, but it's never usually a single treatment.